WREC News Time is 6:15. 88 degrees our high today. Enjoy it because we got a chance of rain moving in tomorrow. We're holding steady right around 66 right now. Good morning. I'm Karen Perrin, joined on the program right now by Dr. Russell Skinner, who is an expert on DNA. Good morning, Dr. Skinner. How are you?
I'm fine. How are you?
Just fine. Now, earlier this week, I guess we heard about this study, how being tall could be linked to a higher risk of cancer. Now, I know folks that study DNA and genetics and all of this are finding amazing things, but if you're tall and you maybe are more predisposed to cancer, what are you even supposed to do with that information?
Well, you know, it's important for your listeners to realize that the study did not show a direct cause and effect between being tall and getting cancer. So if you're out there listening and you're tall, it doesn't mean you're going to get cancer. What the study did show is a correlation between height and cancer risk. And the real question, of course, is why is that? You know, the couple of leading theories right now are that larger people have more cells in their body, and each cell has a potential to mutate into a malignancy. The other is, was there some exposure during childhood or adolescence that caused them to get tall that now also may be causing them to have an increased risk in developing a cancer in adulthood? Now,
we hear about kids today developing at a younger age, and people have changed over the centuries. Are we getting taller as well?
I don't have all those numbers right in front of me to answer that question. Generally speaking, we have gotten taller, but the belief is that it's because of better nutrition and so on. So we eat better now than we did 100 years ago, and therefore we are better fed and we grow better. There's also a link to how our foods are prepared and so forth, and it can be very multifactorial. What is interesting is that so much of what we're now learning that is linked to genetics, whether it is how tall someone is, what their cancer risk is, what diet is best for them, what type of exercise is best for them, what medications work best for them. It's really kind of an exciting time to see that what we've always believed is genetic, or at least has a genetic link, now we can actually test for and make decisions medically based on.
Now, what could you do with information like this? You know, you can't teach tall. You're tall or you're not, and you are fortunate to be that way if you needed to be tall in your profession, for example, if it's basketball. But when you're gathering this kind of information and we're able to look into the future and how this could help, what could somebody do with this information? Be tested more frequently because they're tall? Is that how they would kind of work something like this?
You know, I would. My advice for a patient, if they came in having read this and said, "I'm 6'4", what do I need to do?" I don't know that this study warrants more frequent surveillance or more frequent screening, but I would definitely advise my tall patients to not miss their recommended screening intervals. If you are, a tall person, one of the things this study linked to is increased risk for melanoma. You should be getting a full-body skin check once a year. Everyone should, but, if I know I'm 6'4", maybe I really want to make sure I get that done. There's another study that shows an increased risk for development of colon cancer. Well, we already have recommended screening intervals for colon cancer screening, but not everyone's always real good about doing them. And so if I have someone who's taller and I know they may be at increased risk, I definitely would encourage them and think they should make sure they're getting those checked at the recommended intervals.
Can we get off topic just a smidgen? You just talked about, colon cancer. When you're talking about that, and they set the time that you should get screened for that, I believe it's 50. But if you have a family history of that, and so you might be genetically predisposed maybe, and they suggest you go in earlier, is that some of the other things that you're kind of studying and how people can use this to information in their family history to possibly prevent disease?
Absolutely, and we've had most of those recommendations have been based on just the history in the first place. And now that we're getting more and more of these genetic tests that are available that can look for, do you have a genetic predisposition in you as an individual? We can look at someone's family history and say, all right, you've had several family members that have developed this. You probably have a genetic predisposition. But that is only because of the history. The question is, do you as an individual in that family have an increased risk? And now we're starting to get more and more tests where we can actually test that individual's genetics, and do they have the gene that puts them at an increased risk?
Well, it's an exciting time to be in the medicine that you practice.
Yes, it is. Yes, it is. I actually use a lot of these DNA testing and screenings for determining what diets are best for people, what exercise they respond to best, what medications are likely or not likely to work in a particular individual.
Again, we're talking to Dr. Russell Skinner, who's an expert on DNA. I have a kid with a food allergy, and I don't know if that falls under your realm of expertise or not, but is that a possible genetic thing, even though you can't necessarily pinpoint someone in your direct family who had a food allergy? Could you be genetically predisposed for that?
Yes. There's a certain genetic component to everything. So did your child have a genetic predisposition to it? Possibly, but had they never been exposed, might not have actually ever realized that into a problem. Most medical things is a combination of your genetics and then whatever environmental exposures you're subject to.
Well, we could talk to you for hours. Dr. Russell Skinner, an expert on DNA. So basically, though, back to the beginning of our interview and the study, being tall could be linked to a higher risk of cancer. And no matter your height, though, it's important to get your regular screenings and check in with your doctor. Yeah, I guess that would be the best advice here.
Yes, ma'am.
All right. Dr. Russell Skinner, thanks for joining us today on Memphis Morning News. We appreciate you being with us.
Thank you, Karen.